Breast cancer is the most common type of cancer in women. Worldwide, it is the leading cause of cancer-related death in women. Most early breast cancers are usually asymptomatic, and they are often detected as an abnormality on a mammogram during screening programs before the initial symptoms appear. Risk factors for breast cancer include advanced age, typically more than 65 years, inherited genetic mutations, having multiple first-degree relatives with breast cancer, family history of early-onset ovarian cancer, exposure to ionizing radiation at a younger age, reproductive factors such as late age at first pregnancy, nulliparity, early menarche, and late menopause. Additional risk factors include obesity and sedentary lifestyle, smoking and alcoholism, and unhealthy dietary patterns. Factors that reduce the risk of breast cancer include breastfeeding, active lifestyle, prior risk reduction breast surgery, age less than 20 years at first pregnancy, low bone mineral density, and tamoxifen use. As already mentioned, early breast cancers may be completely asymptomatic. Following are some of the common signs and symptoms of breast cancer. Changes in breast size or shape. For example, asymmetrical breast may indicate an underlying breast cancer. Skin dimpling over the breast. Recent nipple inversion. Presence of a lump. Skin texture changes. Spontaneous bloody discharge from a single nipple. Axillary lumps due to metastatic spread of the cancer. Orange peel appearance of the breast skin, and dilated veins of the breast. Pain and discomfort are typically not present in breast cancer. And presence of a lump does not necessarily indicate that it is a cancer. However, if the lump is hard, irregular in shape, and is fixed to the muscle or skin, it is more likely to be a malignant lump.